Hi, my name is Dr. Stephanie Rose, and I am the program director and a professor for the Addiction Studies program at the University of Central Arkansas. And I have two awesome guests who are joining me today to kind of talk about their experiences since completing the program. And I'm just going to let them kick it off. So, Miss Henderson, could you please introduce yourself and just kind of tell us about your experiences?
Okay, my name is Candace Henderson. I am currently Chief Operation Officer for Lake Point Recovery and Wellness here in Russellville, Arkansas. Just a little bit about my journey. I entered the Addiction Studies program back in 2014. Just kind of getting in the program, just kind of filling things out, took some classes and said, this is kind of where I needed to be, just for even my own experiences of growing up, of just seeing, mental health, substance abuse wasn't something that was normalized. So I graduated with my bachelor's in addiction studies in 2016 from UCA. From there, kind of didn't really know what direction I was going. Just a kind of graduate, glad that I got a bachelor's degree, and I started kind of working at Conway Human Development Center. I got a call one day from a medication-assisted treatment clinic in Little Rock that said, "Hey, we see your resume. I know you're first time counselor. I knew nothing about CIT until I got there, became CIT, which is under the Arkansas Certification Board, and got a job there. First job working with individuals on medication assisted treatment. It was something that was new to me. Never knew that you could treat addiction with medication and it be something that's effective for individuals, but that was a good experience for me. Kind of moving in from that, I got an opportunity after I actually, the place that I internship was Freedom House, which was Lake Point, formerly Freedom House. I actually got a job there and got to come back to Russellville. On that journey, I was actually able to be certified there as an ADC. So just that process of being CIT, you have to do so many supervision hours in order to become certified as an alcohol and drug counselor. Did that for about 2.5, 3 years. And I guess a calling of wanting me in another modality, I went to drug court in Conway. So with my ADC, I was actually able to become a drug court counselor, work in conjunction with attorneys, prosecutors to help individuals get a second chance to change their life, to see that outcome of being productive community members. Again, got called back to where I'm at now at Lake Point, and they're like, "Hey, we want to have you back." I got the experience to work with federal clients. They were post-trial, post-conviction. So just a little bit about that. People who get on indictments, they do have to do pre-trial or post-conviction, but they don't just let them sit out. They give them rehabilitation of up to that court date. Was able to work with those individuals and kind of learn that side about what treatment looks like on the federal side. So that was good. And then I was able to go, oh, yes. And it was just, it was a whole different ball game, but it was good experience to get that skin in the game. And then just being, a chief operations officer, I say that to go through that history of me starting at UCA, not knowing what I wanted to do and thinking, what can I do as a CIT? It took me through a lot of treatment modalities, and it has helped me to see the overall, not just what treatment looks like on the clinical side, but also the administrative side. So just because, going through this program, it doesn't limit you to just being a counselor. You can do community outreach. You can do prevention. It can give you that experience of, if you do whatever you go into mental health counseling or other things such as LCSW, because it kind of gives you that ground of what co-occurring looks like, and it kind of puts you ahead of being able to, if you could diagnose this person to see, you know, is it a mental health problem? Is it a substance abuse problem? And I just a little bit about me. I do serve on the Arkansas Substance Abuse Certification Board. So actually being on that, having my ADC, that's something else that is a requirement to be on that board, of actually going through that and being able to be a part of a board to advocate for ADCs and AADCs, which is an advanced alcohol drug counselor, which is a master's level credential. That's been great to see. And serving on other boards, the AAA DAC board for counselors to help with learning CEUs, meeting new people in the community, going into learning the backside of what it puts into having conferences for individuals to continue education. So that's kind of my long spiel.
Yeah, but
Yeah.
it's really cool to hear all the different things that you can do with your degree.
Yes.
And another thing we have added to the program is once students go into their internship, they actually get certified as CITs before they start their internship, so that they can count all of their internship hours toward their certification. So we're really proud of that.
Yes, yes.
And we've recently been nationally accredited by NASAC through NADAC. So very exciting stuff. Thank you for sharing.
That's great.
That was a lot. Yeah.
Yeah.
Christine, how about you?
Hi, I'm Christine Ensminger. I just graduated December of last year with my bachelor's in addiction studies. I came about that path kind of a roundabout way. I started back school in January of 2021, and was wonderful because everything was online at the time. And then when things started changing again, I actually reached out to Dr. Rose. I was like, I don't know what I'm going to do, because I can't be on campus with 4 kids and being, a single parent. It's not going to work. And so she kind of led me down a path more into the addiction studies, which was my minor at the time. And so I flipped things around and got my bachelor's in addiction studies. And so, like you had just mentioned, was able to get my CIT before internship. And so I started up in Conway doing that, and then graduated, and I'm down here at Next State Recovery Centers in the IOP program. And so my day looks like leading group sessions. I have a caseload of 10 clients right now that I see one-on-one. And I love being able to get the experience on the front end as I continue my education, working towards my master's in social work with the intention of going private practice someday. And so being able to work with all these dual diagnoses, co-occurring, kind of finding maybe different niches that I wouldn't have otherwise been exposed to, has been a really, really amazing opportunity. And just seeing people come in, seeing them do the work and be supported doing the work, and the excitement and knowing that their lives are going to be what they want them to be in a healthy way. So it's been a really, really rewarding experience.
Oh, yeah. And I would like to point out that Christine was the College of Behavioral Health Sciences Student of the Month while she was at UCA. And that was something we had just started. And Candace totally would have been one too, had we had that going. So it is wonderful to hear, see, and just y'all are change makers. Thank you for everything you're doing. And it's amazing what you've done with your degree and your experience at UCA. So I look forward to continuing to see the amazing things you do and the people's lives that you touch along the way.
Yes.
Thank you.
Thank you for making time for this.